I'm Dr. Alexandra Talay. This is my patient, Samantha Numchucks. And today, we're going to be doing some reflexes. So first, we're going to do deep tendon reflexes. Alright, this is my reflex hammer. Alright, and I'm going to be tapping you in a couple different spots. Okay, let us start. We're going to start with jaw jerk. Press slightly. I want you to relax as much as possible and also close your eyes. Okay. Let's do biceps. Go for the tendon, traction down. Got it. Okay. Brachioradialis. Sure. All right, triceps. Hope. So far so strong with this one. Cool. Patellar. Can you scooch back on the bench a little bit? Let's try. Yay! It seems to not be working. But don't fret, because we know the gendrastic maneuver. So, because it's in the lower extremity, we're going to have the gendrastic maneuver be done in the upper extremity. So, as I tap your tendon, I want you to take your hands, and as soon as when I'm about to tap, you go, boop, you pull on them, alright?
Like this?
Boop. A little higher pitched. Boop. Yeah, perfect. Ready? Good. If the reflex was in the upper extremity, I would have them do the maneuver like this in their lower extremity. All right, let's do Achilles. I'm going to put the foot into slight dorsiflexion, and then I'm going to tap the tendon. Great, I felt it. I felt that too. Okay, cool. So let's do visceral reflexes. All right, so we're going to start with direct light reflex. So I'm going to be shining the light in her eye, and I'm looking for that ipsilateral pupillary contraction. Can you take your hand and cover it on the bridge of your nose? Perfect. Oh, got it. Nice. Great. So for this, optic is going to be sensory, oculomotor will be motor, and then they're going to integrate in the midbrain. For indirect, I'm going to shine the light on her right eye, but I'm going to be looking for her left, the contralateral side, her left eye to have pupillary contraction. So anyways, yes. Okay. Relax. Wasn't even looking. It worked. Let's do the other one. Alright. Great. Same thing goes for this. Sensory will be optic nerve, motor will be oculomotor, and they'll integrate in the midbrain. Accommodation. So I'm going to be bringing this into right around your nose. I want you to follow it, okay? Good. So as the eyes are converging, I'm looking for pupillary contraction. Sorry, constriction. Have I been saying contraction the entire time? Who knows? Pupillary constriction. Same goes for this. Optic nerve will be sensory, oculomotor will be motor, but this time they're going to integrate in the occipital cortex. For carotid sinus, I'm going to be feeling your pulse. The force is not strong, but it is fun. But I felt it. So I'm going to press on the carotid sinus, and that will cause a decrease in heart rate. I'm going to do the other side just for good measure. See, so slow that she falls asleep. Yes, so sensory will be glossopharyngeal nerve, and he'll convey this to motor, which will be the vagus nerve, and they integrate in the medulla. Now we're going to do oculomotor reflex. Similar idea. I'm going to be pressing over your eyelid gently. So if you could close your eye. Great. Once again, I'm looking for a decrease in heart rate. Okay. So trigeminal nerve will be so sensory is trigeminal nerve. The motor will be vagus, and they're integrating in the medulla. Yeah. Okay. Ciliospinal. I'm going to be grabbing right around her trap area, and I'm going to be looking for pupillary dilation. I actually saw it. Wow. So yeah, cervical sympathetic chain is going to be doing both sensory and motor, but they're going to be integrating in the T1, T2 spinal cord area segments. All right, let's do superficial reflexes. Okay, here's the thing. I would have to do corneal and the gag reflex, aka pharyngeal reflex, but it's pretty invasive. I'm not gonna do it. You can't make me. But yeah, so for corneal, what I would do is I would take a cotton swab and I would run it on her cornea / sclera of her eye, and this would cause her rapid blinking as well as a tearing effect. This would be because the trigeminal nerve would be sensing it. The vagus would be the motor part. Just kidding, it's facial nerve. Yes, and they would be integrating in the pons. Of all places, they choose the pons. So that's corneal. For the gag reflex, I would take a tongue depressor and press it on the back of her tongue / her throat area, and that would cause her to gag. The glossopharyngeal will be sensory. It will integrate in the medulla. Yeah! And motor will be vagus. Great. Why don't you come on over here and let's check out her back? Can you remove your shirt? Would you lay down for me? Thank you.
Sorry, I thought I was going to be seated.
No, it's my fault. So for this is called interscapular reflex. What I'm going to do is I'm going to take this object and I'm going to scrape it along the medial border of her scapula. What I'm looking to see is the scapula to have this inward, downward rotation, or a drawing inward. So I'm going to do that on both sides. Oh, I don't even know if you could see me. There we go. Did you even see that? There you go. Sorry, my bad. For this, we're going to have the sensory will be the T2 to T7 spinal nerves. It'll integrate there, and then motor will come out of the dorsal scapular nerve. And that will be causing this drawing inward of the scapula. flip on over for me, and we're going to do abdominal. So, for here, I'm going to be taking the same thing, and I'm going to, in each quadrant, I'm going to be pulling in like this. Now, what I'm looking for, the reflex would be the umbilicus deviating to the side that I swiped. Now, here's the caveat. If both sides are absent, cool, we're in the clear. But if one is absent and the other is present, that's when pathology might be present. For this, you're just going to have sensory being the T7 to T10 / T11 and T12. That's going to be your sensory as well as your motor, but spinal cord levels is T7 and T12. Spinal cord. Let's do plantar. All right. Let's see. So, luckily we just showered. She has clean feet. I'm going to do this along the plantar side of her sole of her foot. I'm going to do that to the other. What I'm looking for, something that would be normal right here, is if the toes curled down and inward. This would be a fine plantar reflex. What's going on here is tibial nerve is sensing it as well as being the motor aspect. And where will it integrate? S1, S2 spinal nerves. Now, here's the thing. We have to talk about the pathological reflexes as well. So, let's go back to plantar reflex and I'll show you all the other things that could happen. So, if I do this and she instead nice, Sam. She flares her foot back and outward, splaying of the toes. This is a sustained pathological reflex. This would be considered Babinski's response. How else can we elicit Babinski's response? I'm glad I asked. Here's how we can do it. If we strike down across the anterior tibia, that will be called Oppenheim. Yep, I'm going with that one. That will be called Oppenheim's. And if we saw the same splaying of the toes, exactly, with tremors, that's a positive. Let's go to the next one. Schaefer's. We're going to go along the side like this, around the back side of the lateral malleolus. Same thing, we've got it, which is not a good thing. Now, if I grab the calf, splaying of toes, nice. That would be Gordon's. And if I grab the Achilles, that would be considered Chaddock's. Okay, we did those. Let's work our way into the hand, shall we? You want to sit up for me? All right. So, if I flicked the middle, or the end of her middle finger, there's nothing going on. That's splendid news. But if there was a pathological response, she would have a drawing inward of the fingers with a tremor. This is Hoffman's. Yes, it is. So, if I tapped the middle of her palm, no response. Other hand? Great, no response. But what is the pathological response? Trembling and folding inward of the fingers and thumb. Yes, that would be a Tromner pathological reflex. One more is, I came out of the foot region too prematurely, so let's enter back in. Lay down for me for one more quick second. If she had a positive ankle clonus, when I forcefully dorsiflex the foot,
nothing happens. Perfect. But the pathological response would be if I forcefully dorsiflect and her foot then trembled and went into sustained plantar flexion, that would be a positive ankle clonus. Okie dokie artichoke. This has been Alex and Sam signing off. Toodaloo. Toodaloo.